afternoon, everyone, and welcome to our November Wellbeing webinar, Demystifying Diabetes, brought to you by Univera Healthcare. I want to start out today by thanking each of you for taking the time out of your day to join us here today for our monthly webinar, part of the Understanding Your Wellbeing webinar series that we launched this year. Now, for those of you who may not be aware, November is Diabetes Awareness Month. So with diabetes being one of the most chronic conditions in the world, it often remains one of the most misunderstood. So we thought it was the perfect opportunity to leverage one of our own health plan experts to discuss this topic, as it really is a condition that can impact so many. Now, my name is Katie Keller-Burgess, and I am part of the wellbeing team here at Univera Healthcare. So I will be the host for today's webinar, teeing up our guest speaker, Amanda Chien. Today, Amanda will be breaking down the myths around diabetes, explaining what it is, and really provide some practical insights into prevention as well as management. So let's dive in and start demystifying the topic of diabetes. Now, a few housekeeping items that I do want to start us off with here today. Please note that today's webinar and all of our 2025 Understanding Your Wellbeing webinars are being recorded and housed on our Univera Healthcare YouTube page. So if you need to go back and listen to this webinar or maybe access a previous webinar on a health and wellness topic that we've done, once again, you have on-demand access to those monthly webinars right on our YouTube page. My colleague Kate is actually going to put in the chat the direct link to that page on YouTube, once again, if interested in exploring any other topics. Second housekeeping item is that I do want to call out that all participants' microphones and cameras are automatically disabled. Now, there will be time for questions at the end with Amanda, so if you do have any questions throughout any point during today's webinar, please feel free to enter them into either the Q&A or chat, whichever is your preferred method. But once again, we will get to questions and address them at the end. And lastly, it is important to note that the content covered here today is meant to be educational in purpose. So if you do have any specific health-related question or concern, we do recommend, of course, connecting with your primary care provider. Or if you have a benefit-specific related question or concern, we do recommend calling the customer care number that's on the back of your Univera Healthcare member ID card. So with that out of the way, I have the distinct pleasure of introducing today's guest speaker on the topic of diabetes, Amanda Chien. Amanda Chien is a registered dietitian and a certified diabetes care and education specialist who has been with the health plan since February of 2023. Now, prior to coming to the health plan, Amanda worked as a case manager where she mentored local endocrinologists and became certified in interactive as well as functional nutrition. She has a background in clinical nutrition through a local hospital as well, and has really learned the compassion of diet liberalization through late stages of life in long-term care as well as wound care nutrition. So she started in private practice, both as an in-home dietitian with a diabetes focus, as well as acting as a regional manager for her team. Now, in her personal time, her interests include spending time with her family, cooking, running, camping, as well as participating in dog sports with her golden retrievers. So we are so excited to have her here with us today. Amanda, thank you for being here. With that being said, I will turn the stage over to you.
Thank you, Katie. Thanks for that wonderful introduction. I appreciate you all taking the time to be with me today. So we've got a pretty packed agenda, so let's get down to it. We're going to go through what diabetes is and how it affects the body, the types of diabetes, the risk factors and how to know if you're at risk, complications to watch out for and how to prevent them, managing diabetes with nutrition, exercise, and medication. And Katie's going to talk a little bit more about additional benefits and resources offered by the health plan as well. So what is diabetes? Diabetes is a condition in which your body's blood glucose or blood sugar is too high. It can happen for a number of reasons. Your body does break down most of the food you eat into sugar called glucose and releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin, and insulin acts like a key to let the blood sugar into your cells and organs to use it for energy. But with diabetes, your body either doesn't make enough insulin or it's making insulin and it's not utilizing it properly. It's resistant to the insulin that it is making. So it's causing extra blood sugar to hang out in your bloodstream. Some common symptoms might include increased urination, hunger, and thirst if you're a diabetic, or blurry vision, tingling or pain in hands and feet, or fatigue as well. So the first type of diabetes is type 1 diabetes. This is an autoimmune disease, meaning that your body's own immune system attacks the beta cells in our pancreas, or the cells that make insulin, and destroys the beta cells. So your body's no longer secreting insulin. This treatment only can be treated with insulin. So you cannot use oral medications with type 1 diabetes. Insulin is used to treat type 1 diabetes. Type 2 diabetes is a little bit different. It occurs when your body is not using insulin properly. So this is the portion where it is insulin resistant. So your pancreas is making insulin, often extra insulin, but your body is not keeping up with it or not utilizing that insulin appropriately in regulating your glucose. So with this type of diabetes, you can utilize both oral, injectable anti-diabetic medications and insulin therapy. So there's a couple more options with treatment for type 2 diabetes. And like with most things, there's other types that don't necessarily fit the mold. So LATA is one of those. Latent autoimmune disease in adults is an autoimmune response like type 1 diabetes. However, the immune response is a lot slower, causing the onset to be slower. With type 1, usually it happens kind of overnight, very quick diagnosis. With LATA, this happens a lot slower, and people will eventually need to use insulin therapy. The next type is called maturity onset diabetes of the young, or MODY. It's an inherited form of diabetes, most likely to affect young adults, and can occur at any age. This can only be determined with genetic testing if you have this gene for this type of diabetes. Treatment for this type can be oral, injectable, and anti-diabetic medications along with insulin therapy as well. Gestational diabetes is a type of diabetes that happens during pregnancy. It does affect up to 9% of pregnancies in the US each year, according to the American Diabetes Association. Placental hormones can sometimes block a mother's insulin, causing insulin resistance, and can cause the body to produce more or potentially not enough insulin. Half of these women that have gestational diabetes do develop type 2 diabetes later in life. So this is an increased risk factor. Women are usually screened between 24 and 28 weeks with a glucose tolerance test. And most women, once the baby is delivered, the gestational diabetes does resolve. So how prevalent is diabetes in the US? It's pretty prevalent. 38 million people have diabetes. That's 1 in about every 10 people, and 1 in every 5 people don't even know that they have it. With prediabetes, 98 million Americans have prediabetes, and more than 1 in 3 have prediabetes, which means that more than 8 in 10 adults don't even know that they have prediabetes. So this is really important call out to have routine screenings with your healthcare provider to make sure you're not one of these people that don't know that they have prediabetes or diabetes. The other plug-in I just wanted to mention is that the National Diabetes Prevention Program has also shown to reduce the development of diabetes from prediabetes by 58%. So if you are in this prediabetes category, the Diabetes Prevention Program is a great program to take a look into in prevention of that going into diabetes. So how do we know if we have diabetes? We need to take a look at our blood work. The big one that we take a look at the most would be your A1C value. Your A1C is your average blood sugar over the last 2 to 3 months. So it's a look back of what your blood sugars have been averaging over the last 2 to 3 months. So if you are a diabetic, your A1C is 6.5 or higher. That is the standard for diagnosis of diabetes. Pre-diabetes is between 5.7 and 6.4. And a normal A1C is below 5.7%. Now, fasting blood sugar tests, glucose tolerance tests, and random blood sugar tests can also be done to diagnose diabetes. However, a lot of physicians, if they do come back higher, like a fasting blood sugar test is elevated above 126, many doctors will run A1C as a double check to make sure that you have been averaging that high. So A1C is usually the most common, but the other factors are also used to see if there are any elevated glucoses. What are some risk factors with diabetes? Well, if you have a family history, like myself included, that's a higher risk factor. Prediabetes or gestational diabetes history, as we mentioned, about half of gestational diabetics can become type 2 diabetics. Polycystic ovarian syndrome or PCOS. Physical inactivity, overweight or obese status, non-alcoholic fatty liver disease, and certain ethnicities are at a higher risk for diabetes. So what do? We want to know what our numbers are, our ABCs. So A stands for that A1C value we were talking about. We want to keep our A1C less than 7%. That's the American Diabetes Association guideline for a controlled diabetic. So less than 7% A1C is controlled diabetic. We want B for blood pressure. So we want to aim for under 140 over 90. And C stands for our cholesterol levels, which also can include our triglycerides in that lab values. So our total cholesterol, we want that less than 200. LDL is our bad cholesterol. We want less than 100 for that. HDL is our good cholesterol. That's the opposite. We want that 40 or higher. Higher the better for HDL. And triglycerides, we want less than 150. So I want to talk about complications of diabetes real quick, but before I do that, I always make sure to say that complications of diabetes happen with people that have uncontrolled diabetes for long periods of time. So we can reduce our chances of developing diabetes complications if we get our blood sugars under control and keep it there as long as we can. So the important thing is to get our numbers down and keep them down to prevent some of these complications from happening. The complications can include things like retinopathy or affecting your eyes, kidney disease, neuropathy affecting nerves in hands and feet, heart attacks, heart disease, and stroke. People that are diabetic are actually 2 to 4 times more likely to have a heart attack or a stroke, so very important. Foot complications such as poor circulation or loss in feeling of feet, delayed wound healing or increased risk of infection because infection and bacteria like sugar. So we got to be careful with getting those numbers down. Periodontal disease such as gum disease, hearing loss, diabetic ketoacidosis in extreme cases, and increased risk of Alzheimer's. So who keeps us in check? We want to make sure that we get all our annual screens and routine care. So primary care physician, we do want to see and get our wellness screen done at least once a year. Endocrinologists are diabetes specialist doctors, so they are great with helping manage diabetes specifically. Eye doctors, ophthalmologists or optometrists can do a diabetic retinal eye exam yearly to make sure that the diabetes is not affecting your retinas. A podiatrist can help keep tabs on your foot circulation, feeling, and health at least once a year. It's important to make sure your dentist is aware and checks your gums for periodontal disease. Registered dietitians and certified diabetes care and education specialists can help you with understanding the diagnosis, with lifestyle changes, and helping you with support with diabetes. And neurologists or nephrologists for kidney function or nerve function if you are having any symptoms. It's also good to try and get an annual flu shot to keep yourself healthy throughout the year as well. So what do we have control over, right? So if we're diagnosed with diabetes, what can we control? So we can get moving. We can improve our nutrition. We can go for our routine tests and screenings with our doctor. We can take our medications as prescribed, and we can quit smoking if it is applicable. Smoking does speed up the process of diabetes complications. So that is something that we do want to try and quit if we can or if we're thinking about it. So let's get moving. Exercise is extremely, extremely important for managing blood sugars. It can actually help reduce glucoses up to 48 hours after exercise. So it is huge with maintaining good glucose control. So we do want to try and get at least 30 minutes a day, 5 days a week of moderate intensity aerobic physical activity, or 75 minutes a week of vigorous intensity aerobic activity. And we do want to make sure that we're building our muscle strength at least 2 days a week as well. So we want to do a combination of aerobic and muscle strength. And only 1 in 5 adults and teens actually get enough exercise to maintain good health, according to the American Heart Association. The one thing I do want to make sure I mention is that if you are starting a new routine, to make sure that you get clearance with your doctor for things that are safe for you with your health conditions before starting anything new. So diet and diabetes is also extremely important with managing glucoses. If it's indicated to promote weight loss, we do want to try and do so by reducing our calories between 500 and 1,000 calories a day, depending on your needs. We want to reduce our fat intake. We want to limit our added sugar intake in both food and beverages. We want to increase fiber. So women should aim for about 25 grams a day and men about 38 grams. We want to try and increase our whole grains by making half of our grains whole grains. And we want to try and increase our fruit and vegetable consumption, specifically non-starchy vegetables, which I'll go through in a little bit. And also, lastly, the American Diabetes Association came up with this really nice guide of a diabetes dinner plate, which I will also be showing in a couple slides here, of a picture of how we can portion our plate out with our nutrition. So when we are creating our plate, we want to make sure that we are fitting in all 3 macronutrients. We want to have a carbohydrate, a protein, and a healthy fat at our meals and snacks. Carbohydrates are the main one we focus on with diabetes because they do raise glucose, but it is our brain's main energy source. So we cannot cut out carbohydrates. What we want to do is we want to make sure that we spread our carbs out throughout the day. Because if we have too many carbs in one sitting, that's when our blood sugar spikes too high. Our diabetes causes not proper digestion with the carbohydrates. So we're not fully digesting all of our carbohydrates if we overload our system, and that's where the extra glucose is coming in our blood. So what are carbs? Carbs are things like our grains, our rice, our cereals, our pastas, fruit and fruit juices, milk and dairy products, except for cheese. Cheese falls in the protein category. Our obvious carbs would be things like sweets and candies and cookies and baked goods and sweetened beverages and sodas. And our starchy vegetables, such as peas, corn, potatoes, beans, legumes, and winter squash, like butternut or acorn squash. So again, I'm not telling you have to cut these foods out. We just want to make sure we're aware of what falls in this category so that we spread them out throughout the day. We're picking maybe only 1 or 2 things out of this category and then moving on to another one. Non-starchy vegetables have the least amount of carbs in them. So these are the ones we want you to eat a lot of. So take note if there's any on here that you like. So a serving size is about 3 cups raw or 1.5 cups cooked. So you can eat a lot of them in a sitting. So fill up on them. So these are the ones that the American Diabetes Association wants us to fill half our plate with. Proteins, we want to try and pick lean proteins. Those are things like chicken breast, turkey breast, pork loin, fish, veal, egg whites, nuts and seeds. Some of our healthier fish would be things like salmon, sardines, tuna, herring, oysters, clams, crab, shrimp, and lobster. We do want to limit high-fat proteins, not that we have to eliminate them, but just want to pick them maybe once or twice a week. So things like bacon or beef or hot dogs or bologna, pastrami, bratwurst, types of sausages, things like that. Proteins do take longer in the body to digest than carbohydrates. So when we pair them with a carbohydrate, it does help keep us fuller longer. So with fats, we want to try and pick unsaturated fats. Those are our heart healthy fats, the ones that raise the good cholesterol, the HDL cholesterol we were talking about. So things like nuts, seeds, avocados, olive oil, vegetable oils, fattier fish. Those are the things we want to pick more often. We do want to limit unhealthy fats or saturated fats. So those would be things like high-fat meats, high-fat dairy products, butter, heavy cream, cheeses, lards, coconut oils, and palm oils. And we do want to just, so when we talk about how limiting we want to be with these, we want it to be less than 6% of our daily calorie intake. So it would be 11 to 13 grams for 2,000 calorie diet. We also want to try and make sure we use low-fat cooking methods, so things like baking, broiling, grilling, roasting, and low-heat saute. So we don't want to heat the oil to the point of frying. We want to keep that a low heat when we're cooking all of our foods. Trans fats are a tricky one because sometimes the labels will say 0 trans fat on them, but they might have them in the ingredients. So it's really important to take a look at the ingredients to look for hydrogenated oils. So those are found in things like baked goods, pizza dough, pie crust, cookies, and crackers. Peanut butter is another one that can have trans fats in them with the hydrogenated oils. And for our regulations currently, if there's half of a gram in a product, the label can be listed at 0. Therefore, we do want to always check the ingredients for that partially hydrogenated oil. The diabetes dinner plate is a great method of what we can do to how to portion our plates most of the week for dinner. So we want to do half our plate, 3 cups worth of those non-starchy vegetables, that nice big diagram we were looking at earlier. We want to do a quarter of our plate a lean protein. And then the last quarter of our plate can be a carbohydrate or a starch of some sort. So this is where like your potato or your grain or your pasta would come in, or your slice of bread, things like that. So we're not eliminating, we're just picking one, and we're filling up more so on the non-starchy vegetables and the protein sources. The important thing is we want to make sure that we're reading labels. So we want to take a look at what our serving sizes are, the saturated fats, those are the bad fats we were talking about. We want to get those as low as we possibly can. Total carbohydrates is important to take a look at. So if you look at number 5 listed to total carbohydrates, it says 37 grams. That is the total amount of foods that will raise your blood sugar. Now, underneath it says total sugars. That number is already counted in total carbohydrates. So we're really looking at total carbohydrates for the entirety of what raises your blood sugar. Fiber is something we want to have higher, 3 grams or more for any breads, rice, pastas, and cereals and grains. And then lastly, we can take a look at our protein and how many grams of protein are in our foods. So I wanted to give you some ideas for some healthy snack options. So as we mentioned before, we don't want to eat just carbs at a sitting. So we want to ideally pair a protein or a healthy fat with our carbohydrate. So our protein source is a good source to be between 6 and 7 grams of protein. I have a list there for you for those. And then your carbohydrate, we want to try and keep it around 15 grams of carbs for your serving size. So really this is meant to be like a mix and match. So grab a protein source, grab a carb, and that's kind of your healthy snack idea. So again, we want to try and pair them together so it keeps us fuller longer instead of just picking a carbohydrate for snack. Some ideas for healthy swaps would be to use, instead of rice, pasta, and potato heavy dishes, to try rice cauliflower, zucchini noodles, spaghetti squash, or mashed cauliflower. If you don't like just the rice cauliflower by itself, some people like to mix half regular rice, half cauliflower. And same thing with pastas, half zucchini noodles, half pasta, just to spread that a little bit further. Instead of deli subs and sandwiches, looking for lower carb wraps, lettuce wraps, or reduced carb breads. And instead of sweetened beverages like soda, juice, or tea, we want to try and use unsweetened seltzer water, or try to do half juice, half water, or an unsweetened tea. Instead of white flour, trying to utilize chickpea or almond flour. That's a huge difference as far as your carbohydrate intake. So chickpea flour has only about 27 grams of carbohydrates for a half a cup, compared to 48 grams in a half a cup of flour, white flour. With pizza, we want to try maybe cauliflower crust pizzas. And then with granola on yogurt, granola and yogurt are both in the carb category. So like we were saying, we just want to swap that out to maybe a protein or a healthy fat source. So almonds or walnuts have healthy fats and protein in them. So we want to top that on the yogurt instead. Instead of chips with dip, we want to do fresh vegetables with the dip, like carrots, celery, pea pods, peppers, all those good non-starchy vegetables we were chatting about earlier. And instead of fruit pies or baked goods, maybe trying berries topped with whipped cream or paired with a dark chocolate square. So let's wrap this all up. When we live with diabetes, we want to make sure that we are trying to make and eat healthy food. We're trying to stay active and move. We want to monitor our blood sugar to make sure that we have it under good control. We want to take our medications as prescribed by our physicians. And we want to manage stress. Believe it or not, stress levels can increase glucoses aside from just food. So I know easier said than done, right? But trying to manage stress can be helpful with your glucoses as well. And continue to build on all the healthy habits you've already implemented. Some good recipe resources. People are always asking me, how do I find good ideas for someone with diabetes? So the Diabetes Food Hub is run by the American Diabetes Association. They have a ton of good recipes that are carb healthy. There's the Academy of Nutrition and Dietetics. They have a lot of recipes on their website as well. And the Center for Disease Control actually has a recipe booklet for people with diabetes as well. So those are some areas to kind of browse and see if there's things that you like that can help with your menu planning. And if you just wanted to learn more about diabetes, these are some great resources for you. So the Academy of Nutrition and Dietetics, the American Diabetes Association, the American Association of Clinical Endocrinology, so those diabetes specialist doctors, and the Centers for Disease Control. And at this point, I'm going to be wrapping up and handing it right back off to Katie.
Awesome. Thank you so much, Amanda. That was a lot of great information covered. And personally speaking, like yourself, from someone who has diabetes that runs in my family, it's something that I need to be aware of and more cognizant of. And I think, everyone attending here today has learned some great information to be aware of as well. So thank you for your expertise. As mentioned, we will get to questions in just a few minutes. So if you do have any questions, please feel free to enter them once again in either the chat or the Q&A icon at the top of that Teams webinar, and we will get to them in just a few minutes. But the next segment here, I wanted to cover, as mentioned, some related benefits and tools that are available to Univera Healthcare members. I do want to call out that the availability of these programs that I am going to review does vary by contract, but if interested in seeing if it is something available to you, we encourage you to log into your Univera Healthcare online account, or once again, call that customer care number on the back of your health insurance card. So first off, I want to talk about our Find a Doctor tool on the Univera Healthcare website or mobile app. So once again, if you are somebody on this call, maybe looking to get support for diabetes, I know Amanda mentioned, some great healthcare professionals such as endocrinologist, connecting with your primary care physician, etc. So really the Find a Doctor tool on the Univera Healthcare website or mobile app is helping our members identify those healthcare conditions that are specific to your plan when you are logged in. So it's really showcasing those in-network providers that you have available to choose from, giving you a populated list. You can filter that list of providers to maybe location, maybe radius or distance from your house, if the provider is accepting new patients, languages spoken, and more. So once again, a lot of our members, we often hear a question, well, how do I know if this provider is in network? Once again, that Find a Doctor tool on our website or mobile app really helps to provide those providers in network once you are logged in, hopefully specific to your plan. And with that being said, that cost estimator tool that I mentioned is also another great tool our members can utilize to project for estimated medical cost for any upcoming procedures or services. So this tool, once again, is allowing our members to research estimated medical cost for over 1,600 different treatment categories and over 400 plus procedures. So if you are on a high deductible health plan, really having that information relative to potential costs ahead of time is very important. So highlighting those few tools there. Now, the next tool, program, resource that is available, and I know Amanda alluded to this earlier, but really wanted to highlight once again our care management team and some of the avenues to engage with that care management team, such as our registered dietitians, such as Amanda. You can see how engaging they are, really trying to help educate at the direct to member level on various conditions, whether it be diabetes, as we mentioned here today, maybe high blood pressure or cholesterol. Some, once again, those pre-identifying risk factors associated with diabetes, whether it be weight loss or stress management, as Amanda mentioned, knowing that that can impact our blood sugar levels as well. So really, our care management team is inclusive of a variety of healthcare professionals such as registered nurses, registered dietitians, behavioral healthcare managers, and more. And they are all here to support our Univera Healthcare members at no added charge, really to just provide that additional layer of support with guidance and a personalized care plan to once again help you better manage any of the conditions you may see here listed on this slide. So you can engage with this care management team through phone call, through email, whatever your preferred method is. Or another great way to engage with them is through the WellFrame app. WellFrame is that free app, once again, that Univera Healthcare members can download, create your account. And on the back end of that app, there is an embedded chat feature that you are once again able to connect directly with our care management team or registered dietitian. Once again, this team of members that can help support you personally on your specific questions, right? So just want to highlight the access code for WellFrame if you do decide to check it out and engage is Univera Welcome, all one word, all lowercase. And another quick tidbit, you do need your subscriber ID from your health insurance card when setting up your WellFrame account too. So be sure to have that handy. And then the last benefit program that I wanted to run through is Vitalize. So once again, this is very, benefit does vary based on your specific contract. So Vitalize is a digital home base for our members' health and well-being. It is powered through our partnership with Personify Health, one of the leading vendors in the health and well-being platform space. And it is providing our members the tools and support that they need to make those small, everyday changes to their well-being that are really focused in on the areas that you want to improve the most. So maybe it is trying to be more active and get more movement. Maybe it is trying to be healthier with what you are consuming through food or beverage. Maybe it is trying to better manage those stress levels, right? So once again, many of the tools and resources available through Vitalize are there to help support our members. A lot of great challenges and journeys specific to that diabetes topic, if interested as well. So with that being said, that summarizes kind of those additional benefits and resources available through the health plan. So with that being said, I wanted to thank everyone for taking the time to join today. Before we get into questions, my colleague Kate is actually going to plop in the chat a quick survey link. So she'll do it again at the end, but I just wanted to encourage once again the survey link for anyone here on this webinar to give your feedback on today's topic, and once again provide feedback for further webinar topics. We really want to make these webinars the most meaningful for our members, so hearing directly from you and what you're interested in learning more about helps to guide our programming moving forward. So once again, if you wouldn't mind taking that quick survey. And then the last little plug here for our December webinar. It really goes hand in hand, I think, really nicely piggybacking off of this month's topic, but focusing in on healthy eating during the holidays. So this webinar is Savor the Season, Smart Eating for Festive Times, with another one of our registered dietitians on the well-being team here, Lindsay Ledoux. So she is going to be navigating holiday gatherings with hopefully less stress, being mindful and intuitive with your eating strategies, planning tips for setting yourself up for success this holiday season, some tips for traveling or on the go, as many of us are during the holidays, and more. So this upcoming webinar will be Tuesday, December 16th at noon. There's a QR code here if you have your smart device out and want to scan quickly to get to that registration page. Or once again, my colleague Kate just put in the chat the direct link to register for this upcoming webinar if interested. All right, with that being said, let's see what questions we have. So once again, I'll go into Q&A or chat to see if any have come through. Question that has come through, Amanda, what would you say your favorite go-to healthy snack that keeps you full throughout the day is?
Well, I am a big fan of cheese. I love cheese sticks. So I do I do cheese sticks and pretzels quite a bit. So I'll do like an ounce of pretzel with a low fat, like mozzarella cheese stick. That's a good one. Almonds or walnuts are a great one that I'll do with like a whole grain or a whole wheat cracker, maybe 5 or 6 of those. Apple with some peanut butter on it, things like that.
That's
Great
great, thank
question.
you. And good to
Making me
know for my
hungry.
2-year-old daughter that always wants a daily cheese stick. Now I feel better about giving her said so cheese stick. So thank you for that. Um, Let's see. No other questions, so I'll give it just another couple minutes. But I had a personal question, Amanda, that I wanted to ask. You mentioned kind of with diabetes and knowing what your blood work and your numbers are, right? Whether it be the glucose or the A1C. Recognizing that the blood work is only as good as how often you get it done. I myself, as a mother of a young child, sometimes, as you mentioned, put my own preventive care in the back burner, and just recently, got my blood work done after realizing I haven't in years. And while it is still in the normal range, when I look at my trends from, years past, it is escalating a little bit. So is that something you would say is kind of normal with the aging process, or is it more of the aha moment that I still need to, make those everyday changes and really try to better my well-being as well?
Yeah, that's a great question. And good for you for identifying the trend because a lot of people wait until things are in the red, right, before they start making changes. So I do think that that would be a good point to take a look at maybe what has happened in the last few months, if not half a year, that might be different from previous years. So being a busy mom, like you said, you have a 2-year-old, that could cause some of the things creeping up because I'm a mom too. I have a 4-year-old trying to fit in exercise in the day and things like that that you once did. So just kind of repivoting, looking at your lifestyle, and making those changes that fit for you. So what fit for you maybe 10 years ago doesn't fit for you now. And I guess this is more of a plug-in again, why the case managers are here, like myself, that we work with you in your daily lifestyle to find out what is reasonable for you and what's not, and something that you can live with long term with some of those changes. So I do agree. I think that maybe taking a look at your trends and starting to put in some healthy habits now is not a bad thing by any means.
Awesome. Thank you so much.
Yeah.
Another question that came through is, what are your thoughts on intermittent fasting? There's often mixed opinions on this. Is it something that you feel can help to prevent diabetes, or any research that you can share there?
Yeah, so intermittent fasting, it can be done it can be done in a healthy way. So what tends to happen is if you do go too long without eating, your body's metabolism does slow. We do know that from research. There's a research article out there called the Biggest Loser Study, and it's actually on people that were on The Biggest Loser, showing that people that were on that show's metabolism slowed with under eating. So it is important to make sure you're fueling your body appropriately and eating enough throughout the day and spreading your meals equally throughout the day. So that being said, what we do tend to recommend is to try and fast at least 3 to 4 hours before bedtime. So if you tack that on, stop eating kind of after dinner-ish, and then tack on that 8, 9 hours of sleep-ish, you're kind of doing that intermittent fasting kind of time frame that way. But to start the intermittent fasting and do a 12-hour day and eating one meal a day, they have done long-term research on it and have shown that it has not had any more success than traditional methods. So it's not enough that I would recommend it, especially someone that has diabetes, because we run risk of low blood sugars as well.
Right, right. And I personally, the word hangry resonates with me. So when I know when I go too far in between eating, that really impacts my mood, as I'm sure my husband would attest to as well. But great information and thank you for sharing. Great question. I know intermittent
Yeah.
fasting is typically a common, trend we hear about in the nutrition world. So thank you. All right. I do not see any others that have come through. So let me just double check in the chat. Nope. But once again, my colleague Kate did reference many of the on-demand webinar series, the survey, once again, encouraging everyone to take that few minutes, give us your feedback, and then registering for that December webinar upcoming if interested. So with that being said, Amanda, once again, thank you for your time, your expertise, and your passion here today. Kudos to you and the entire team and all you do that help to support our members. And hopefully, once again, everyone here today was able to learn something to take away on this navigation of our health and wellness journey.
Thank you. Thanks for having me. It was a pleasure.
Thank you. And with that being said, I can't leave this webinar without saying go Bills. Hopefully everyone has a wonderful evening and weekend. Have a good one. Hopefully see you next month. Bye, everyone.
Thank you.